Hello, good afternoon, everybody. I first of all thanks the Kim's Hospital for giving this opportunity to host a YouTube and Facebook live program. And the topic of today's afternoon discussion is a very common topic which causes lot of anguish, lot of pain, lot of suffering to everybody, and that is migraine, right? Before going to the migraine proper, I would like to discuss about something. Tell about headache. Who doesn't have headache? All of us have. In fact, in various surveys, it has been pointed out that 50% of the population at some time or other has a headache. Right? What do? We take a gentle rest, we take a nap, or maybe take a crocin. Right? And we go to sleep, and the headache goes off, and as we are fresh as normal. But this doesn't occur in a subset of population in which the pain keeps on increasing. Becomes disabling. They cannot perform functionally either in the colleges or at the workplace. They can't have a proper family life. There will be social disturbances, and this subset of patients who have such a bad headaches, they are also known to be suffering from migraine. Therefore, in short, migraine is nothing but a type of chronic disease in which the patient continues to have recurrent episodes of bad headaches which are debilitating, right? Therefore, how bad is the disease in the world? In our OPD practice, in the general neurology OPD practice, in every day, about 30% of the patients come with migraine. Coming to the disability it causes enormous disability. And in fact, about 17% of the whole population of the world is suffering from some amount of mild to moderate to severe migraine. And the, according wise, but disability wise, and the neurological disease burden wise, it is next to stroke in causing enormous social and economical problems. Therefore, it's prudent to know about migraine, and can we stop it? Who are the sufferers? Are there only the medications the cure? These are the few topics which all of us have a doubt. All afternoon session, I would be highlighting about it. To start with, what is migraine? What does it trigger? As I have discussed, migraine is a type of headache in which the problem, it usually is in the one side of the headache, and it is pulsating. The patients come and say that somebody is coming and beating with a hammer. It's a throbbing type, and it can be associated with they have severe disturbance to light, sound, and smells. These are few things which characterize a migraine. And if it starts, it can last for 4 to 72 hours, and it is relentless. Patient has to have something or have to go to sleep so that the migraine comes back. Okay. If it is one-off event, that's what we call it as episodic migraine. So be it. Not a big issue. We can have medication and we can have a rest. But in a few subset of population who don't who have some risk factors and who medication don't seem to work, it goes on and on and on, and it converts to a chronic headache, and that is called as chronic migraine, in which the headache may last. There may be continuous headache almost each day in a month, right? Therefore, when we come back to headaches, as of now, there are two classifications of headache, common classification. One is the primary headache, second is the secondary headache. And primary headache is that headache in which when we examine the patient clinically or by doing the various scans, there is no problem. That which can pinpoint, for example, there is no clot, there is no bleeding, there is no tumor which can, or there is no sinus problem which can suggest that this is a cause of the headache. In this primary headache, migraine holds the biggest chunk of the patients. The other common headache is the tension type headache. Tension type headache is nothing. That is the common headache what we all have. It is just a band-like sensation, crushing sensation, and if we just take a little bit of rest, that goes away. And other headache is also a cluster headache. That's also a type of primary headache, which is relatively rare. But here there is lot of suffering, and along with that there will be tearing from the eyes and the nasal stuffiness. And when we come to the secondary headache, when we talk about the secondary headache, these are the headaches for which there is a cause. That means there can be either a tumor. Commonly it can be secondary to sinusitis. Sinuses are the spaces which are present in the facial bones which tend to get infected, or it can be a clot inside the brain or within the blood vessels. That is, in short, there is some cause which is causing such headache. That is called as a secondary headache. Then when we say that migraine doesn't have any problem, why should we get a scan done? The thing is that many a time there are patients in which the secondary headaches, they come with features suggestive of migraine. Therefore, only in such patients where what happens if the clinical diagnosis of a migraine, but the medicines don't seem to help them, or if the headache is persistent and it is relentless, there is no relief, then only we request for a scan so that some bad cause, some worse cause is not missed, right? Therefore, when we talk about migraine, does it have stages? Yes. In fact, migrainous patient will say that, will automatically know that next day I am going to have a migraine headache. This initial phase in which the patient knows that I am going to have migraine, that is called as a prodrome. Prodrome is the phase before the actual disease sets in. And how they become? They will have either they become totally depressed, they become restless, they can have euphoria, they become tired, they can't work. This is what, and each migraine patient will have a specific prodrome, and that is when the disease process kicks in. After the prodrome, they can have an aura. Aura is which is not present in all migraine patients. In fact, it's only present in about 25% of patients, in which before the headache sets in, they will have certain symptoms. Some of them can have a visual blurring. Some will have some spots or lines which are dangling in front of the eyes. Some will have a reeling sensation. Some will have sensory disturbances. Some will feel that there is the hand and leg have become totally numb. Some will have some bad odor-like smell. These are all the symptoms which are called as aura. Important thing about aura is that aura is the start of migraine. When the patient has an aura, it itself means that the migraine has started. After the aura subsides, usually the duration of aura lasts for about an hour. After that, the typical type of migraine headache starts. That can be unilateral. Usually it starts at either side, and it can be throbbing, hitting like a hammer, and gradually it can spread to the whole of the head. Sometimes it comes down to the neck, and many times it can spread to the half part of the body also. Many migrainous patients will say that, sir, along with the headache, it feels that our hand and leg, they have swollen up. They are, sometimes we feel, is it really? That's the problem, or the patient, sometimes what does it say? Definitely, this is the migrainous change which occurs in the brain, which can cause such symptoms to come. After that, there is a prodrome. After the headache comes down, either by medication or just by itself, patient will go to rest. They will feel pretty tired. They need to have a nap, and this whole stage, as I told, migraine starts. It can last for about 4 to 72 hours. Therefore, think of a patient, poor patient, If the headache lasts for 3 days, after that he has a prodrome with a postdrome, then automatically about 4 days are finished. And consider a patient who has about 2 to 3 or 4 episodes in a month. That means how much does it affect his life, either his educational life, work life, social life, or anything. All of them are affected in a very bad manner. Uh, then, as I talked about this, therefore, as I described, therefore, the migraine is one, a common migraine without an aura. There is second, there is a migraine with aura. Migraine without aura is about 75% of the patients, and in a small subset, about 25%, we can have an aura. Now, why does this migraine occur? That is the most pertinent question. There has been enormous strides, and what we now know is that it's not that the blood vessels are getting small, blood vessels are getting large, but it is all the play of chemicals, right? Everybody would have heard about capsaicin, isn't it? Capsaicin, that is the chemical which is present in mirchi. There are some receptors like that which is present in the brain, and these are the receptors which get activated. When these receptors get activated, when such specific chemicals are released in the brain, they cause inflammation. Inflammation means that there is a reaction which occurs at the brain nerves, and this keeps on spreading from one part to another. As it keeps on spreading, the patient will have one by one symptom. And as the pathophysiology of migraine has evolved, and we have come to know about the various chemicals, various nerves, various targets. Now, the next thing is that we will be having soon be having targeted therapy, so that the side effects are less and the patient will have a lasting relief, right? Therefore, when should a migrainous patient come to a hospital? I believe each and when the normally migraine starts at adolescence, and patient will have as they go into adults, as they outgrow, as they reach their about 50, 55, the headaches go away. More common in ladies than in males, and here there is a thought also, the hormones play a major role in migraine. Therefore, especially in females, during their menstrual periods, they will have menstrual migraine, and as they age, as they reach menopause, and it seems that the migraine goes away. Okay, and therefore, before this, as I told, what are the factors which can prevent, what which can precipitate a migraine? One, there is a complex genetic inheritance. It's not a simple that if there is a genetic cause, the patient will have migraine. It's not like that. But it seems that migraine runs in families. In fact, in our history taking, we ask if the patient, we ask, is there anybody in the family who has a headache? It may not be same headache. In fact, we ask, does your parent had a sinus headache, or he used glasses for the headache? Many times they give an affirmative answer, which further helps in our diagnosis of migraine. Right? Other than that, after most important are the risk factors which can precipitate a migraine. They are varied, and they seem to be quite specific for some patients. It can be a lack of sleep. It can be if the patient is suddenly awakened from sleep. It can be a common head bath. It can be traveling in the sun. Some will have a specific trigger as a that agarbatti smell. They can smell it from a kilometer and they will run away, and they will never use that. And along with that, some many times it can be the artificial sweetness, that is aspartame. It can be the Chinese salt, that is Ajinomoto. They are known to be triggers, and it can be also the hing, that is commonly used in the food preparation in our country. All of that can be all of that can be a trigger, and many more. In fact, We encourage our patients to maintain a migraine diary. What does it mean? In that, they are encouraged to find out what was the trigger, what did they do new the day or the day before, which precipitated the headache. And believe me, migraine diary has been one of the simplest method which has helped in decreasing or treating migraine. And apart from that, when we go forward, after we think about the triggers which can be varied, we ask the patients to avoid them, right? Now, when the patient comes to us, how do we go about it? It's most and most is the history. If we get a clear cut history that a patient has a one-sided hitting headache which has along with disturbance in light, sound, smell, and there is a family history, we are pretty sure that we are dealing with migraine. Many times the migraine has been so long, it changes its quality. Therefore, it can be simple headache which is a pressure feeling. It can may not be headache also. They can come with a neck pain, they can come with giddiness, especially in children. They will come with stomach pain and recurrent vomitings. That can also be a presentation of migraine. Therefore, the most important is that having a good history and asking the patient, is this only one headache? How many headaches you have? Many times the headache as that will become a part and parcel of the life. They don't think it's important to tell us. But when we spend some more time, we get a clear history, right? And then after a clear examination, when do we ask for a scan, right? There are few indications in all people should be aware that if there is a worst headache, that is the first headache which has been very severe. If a patient has never had such a bad headache, that is one indication that there may be something wrong in the brain and we need to do some investigation. Or if there is a change in quality, each migraine patient will say, yes, I know this is my headache. But if there has been a change in the quality, third, if there is associated fever, change in the behavior, any weakness of the hands, slurring of the speech, that is, there is some neurological deficit, that becomes one more indication. And especially if there is a new onset headache after the age of 50, they are all the red flags, and such patient should definitely be imaged. And apart from that, now next, how do we go about once we have a diagnosis? Are the drugs the only way? Coming to the drugs, we should know there are two classes of drugs. First, we have to stop the headache at that point. That is called as abortive treatment. That means in which we have to give painkillers. It can be simple paracetamol, it can be simple naproxen, indomethacin, or there are some new medications which are coming on, which hopefully will help in tackling the migraine in a better way without the side effects. Other important is that if the patient has recurrent headaches, usually if it is disabling headache or if it is more than 4 times a month, we give preventive medicine. Preventive medicines, there are many classes of medicine, and depending on the patient clinical characteristics, other features, do they have an asthma, do they have a depressive feature, do they have fits in the past, depending on each class, we can give a preventive medicine and continue. And the thing is that migraine is a disease which stays with us. And in a patient, we make them try to understand that this is just like sugar and BP. It will stay with you. You have to take care of that. And if you maintain a Spartan lifestyle, eat at correct time, sleep at correct time, identify the triggers, avoid the triggers, develop hobbies, avoid stress, and yes, last but not the least, we have evidence that yoga and pranayama have been helpful in decreasing the incidence of migraine. There has been many recent publication from All India Institute of Medical Sciences in the neurology, in which they found out that in two groups
groups of patients were taken. In one group, only medicines were given. In another group, along with medicines, a particular yoga was started along with pranayama. And in the second group, there was a good amount of relief. And after a period, they could stop the preventive medicines. And even after that, the headaches had come down. Now, what do we mean by headaches have come down? Now, this is such a chronic disease. It's that if the headache doesn't totally go away. We look at about having 50 to 60% decrease in the headache frequency. That's what we aim. Once we achieve that, we continue the preventive medication for about 6 months. In some places, in some patients, we can continue for about 1 year also. And after that, as the patient has a good headache relief, we advise a proper lifestyle, development of hobbies, taking up sports, indulging in new challenges so that the patient has a free mind and identify the triggers well, stay away from the triggers. And once they achieve that, we slowly try to decrease the medication. And many times, if they have a proper lifestyle, they can get rid of the medication. I'm hopeful that this small introduction has been helpful. And if there are any questions, I'll be taking them.
Yes, sir. There are some questions from the audience. The first question is, does COVID increase migraine?
Yeah. This we all are going through such a bad phase. Yeah. What is COVID, by the way? COVID is a type of viral fever which is caused by this coronavirus. And as we all know, in viral fevers, along with fever, along with the cough, cold, we have body pains, we have headaches, right? Definitely. Especially, it's not that it's the same as other viruses. It does increase headache, but in a subset of population, coronavirus goes into the brain also, and it itself causes inflammation in the brain. There is infection of the brain, and they can also have fits, seizures, and dullness also. Therefore, but be assured, this occurs in a very small subset. And yes, COVID does increases headache, does changes the frequency of migraine, and we have to be sure what are we dealing with.
Can I ever get rid of it?
Yeah, challenging question, nice question. And as I told, first we have to realize that this is a chronic disease. Does anybody in our family can get rid of their BP? Can get rid of their sugar? No. But with a healthy lifestyle, with proper medication, there are many patients of diabetes, hypertension, so also migraine patients who can be off medicines if they identify the triggers, if they have a proper sleep, and most important, I forgot in my talk, avoid the modern scores, that is the cell phone and excess of the electronic devices. That has been very difficult, especially with now Zoom, online classes, online meetings. It seems they have become a part and parcel. Therefore, what do? I tell my patients, till it is work is finished. If it is not avoidable, use it. After that, no electronic devices. When you go to sleep, everybody of us have a habit of going through a notification, seeing this, seeing YouTube videos, everything. But I have made it a point of telling my patient and trying to practice myself and keeping the cell phone in the other room so that I don't touch it and I'm not disturbed by the notification. Right? We have to realize that migraine is a chronic disease and we have to live with it. If we live with it, it doesn't pose a challenge and we can get rid of the medications also. Whereas what has been seen is that in elderly ladies, especially as they reach their menopause, the migraine incidence comes off and they can get rid of their medications also.
Do migraines present only with headache?
Yeah, that's challenging question, right? Why? Because in children, for example, they may not have a headache at all. They will come with recurrent episodes of abdominal pain and with vomitings. And we have seen many children after many rounds of physician gastroenterological care. Then the gastroenterologist himself calls up. Can you have a look at it and see that whether we are missing a migraine? What happens in migraine is that it has a very severe GI upset, and the patient will have severe vomitings. Therefore, many times they read the gastroenterologist before coming to us. They can present with giddiness, they can come with neck pain, they can come with sensory loss. No, therefore, just not headache, they can come in varied forms. Therefore, a good history can help in the diagnosis.
Does migraine lead to stroke?
Yes, that is the importance of stopping migraine and avoiding the episodes. There are patients, there are subset of population who don't believe in medication. I don't say anything because most of them don't want to take medication. They are afraid of the subsets. But migraine is such a disease. If it is not stopped at the start, or if it is allowed to progress, then in a very small subset, it can cause a stroke. Stroke means blood clot of the brain, and many times it can be devastating. Therefore, that is so much importance that we identify the diagnosis, give the proper medication, and also encourage the patients to have a healthy lifestyle.
Is my headache a migraine? How to identify this?
Correct. Migraine patients, they know this is my headache, right? The features are it starts on the either side. It will be hitting type of headache. It will be associated with. They will have severe sensitivity to sound or lights or both, and along with that, they have severe sensitivity to smells, and it lasts for hours together, and unless they take a medicine or sometimes sleep over. And many times, one of the many most classic feature is that many times the patient will have a vomiting. After big vomiting, the headache goes away. Sometimes patient induce vomiting so that they can terminate the migraine. These are the classical features, so, which will tell a patient that this is a migraine. But always keep in mind, if this is a first time headache, kindly consult a physician so that we can have a proper thorough clinical history, examination, and then rule out or rule in the possibility of migraine.
Are migraines hereditary?
Yes, migraines run in families, yes, and it's not a simple gen that father has that the child has, but there is a complex genetic inheritance, and there is in which the family parents, it can be father, sister, mother, anybody will be having a migraine. It can be of different types, but they have it. There are specific genetic syndromes such as familial hemiplegic migraine, in which patient will, along with the migraine, they can have recurrent strokes. We don't test for genetic testing in each migraine. Maybe in future we will have it, but at answer is yes. There is a hereditary link to migraine.
What is a tension headache?
Correct. The tension headache is the normal routine headache which we tend to have after a long tiring day. That is just a band-like sensation. It's irritant. It doesn't hamper our work, but we feel it gets us to realize that it has been a tiring day, and many times simply stopping the work or having a cup of strong coffee will get rid of the headache. This is the tension headache. In fact, this is the most common type of headache. All of us suffer from it, but that normally doesn't bring the patient to us.
What is a cluster headache?
This is one of the rare headaches, primary headaches, but a bad headache. Why? because it will be incessant, continuous. It can be like somebody is pricking inside. The patients come and say that somebody is poking needle inside the eyes, and it is continuous, and there will be tearing from the eyes. The nose will be stuffy, and they are worst of the headaches. Patient can't take rest. They will keep on rolling about, moving about with pain, and they need to have strong abortive treatments to stop the headache.
Does migraine cause vision problems?
Vision problem in the sense that, as I told before, a migraine in about 25% of patients they have aura, and in this aura, that aura is that some sensory phenomenon. In this sensory phenomenon, the visual symptoms are the most common. It can have a positive symptom or a negative symptom. Positive symptom that there will be dots or streaks of lights. It can be flashing lights. It can be something that suddenly the vision becomes black. These are all the types of vision problems which usually occur before a migraine sets in.
Can children get migraines?
Yes, yes. And mostly the classical migraine starts in the childhood only, and they may have classical presentation headache with vomitings. As I earlier told, they can also present with continuous abdominal pain, recurrent vomitings. Yes, they do have.
How do you prevent headaches?
Uh, the holy grail, how to prevent, right? Uh, uh, I, apart from medications, whenever I write a prescription, I write four things. First and foremost is to maintain a strict schedule. Think, all of us, when we were in our schools, when we used to get up at a correct time, eat at correct time, have a play time, have go to sleep at correct time, these headaches never help. Therefore, even in all our patients, I ask them to maintain a proper schedule of eating and sleep. Second, identify your triggers, stay away from the triggers. Third, decrease your electronic usages. Many of say that my job is to work in front of a computer. How can I stop it? Then I suggest have breaks in between. You can have a Blu-ray film. You can have decrease the luminance of the computers. This is the way. And after your job is over, no need to use electronic gadgets. Avoid them as much as possible. Decrease your stress. Indulge in your games, hobbies. One of the most important. Anything you like. It can be as varied as painting, singing, dancing, taking up gardening, carpentry, whatever you like. Indulge in some social activity. At the weekends, have join a trekking club, go on cycling. These are all the methods I always advocate to my patients. Last but not the least, join a yoga program. Yoga and pranayama, meditation, they go a long way in decreasing stress. Not only stress, it has also now been verified that it can decrease migraine also.
The last question, sir. Are migraines dangerous?
Very dangerous, very dangerous. Why? If we don't take care of the migraines, they can cause enormous loss, social, economic, work loss, school loss. Not that that's okay, but if migraine is not taken care of, patient can have strokes, they can have fits, and they can have so much suffering that life becomes hell. Therefore, definitely, migraine it can be a simple headache, but it can be problematic also. Therefore, I request all the people who are listening or pass on the message. If you have bad headaches, headaches which don't seem to go away with medication, kindly consult your physician. I am Dr. Praveen. I am consultant neurologist at Secunderabad, available daily. Kindly come us, share us the problem so that we can cure you, so that we can heal you, or at least